Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Amir Kishon, a digital health veteran. He is the CEO of RMDY Health, that's RMDY Health, a digital therapeutics company based in New York City, offering a white-labeled SaaS-based platform that enables healthcare stakeholders to easily create their own digital health and healthcare CRM services, establishing an effective bridge between patients and clinicians. Welcome, Amir, and thanks for joining us.
Hi, David. We know each other for too long, so I'm very glad that we have a chance to chat about digital health today.
Yes, absolutely. So I'm going to jump right in, Amir, and say, what do you mean when you say digital therapeutics?
There are a lot of buzzwords out there, but for me, digital therapeutics really stand out. And as a digital health guy for the last 20 years, the notion of digital therapeutics, which is essentially collaborative in nature, which means that rather than providing patients with tools, information, potentially sometimes even communities, you move that digital experience into collaboration between patients and their care providers. And for me as a digital health guy, this is a breakthrough. This vindicates digital health and makes it sensical.
Right. It's a conversation. It's not a question of providing information for people to consume. It's creating an opportunity for collaboration, as you said.
Yeah, I mean, if you want to be kind of honest, the previous iteration of digital health didn't work. The whole idea of giving patient tools or information and expecting them to make sense out of it was not so successful. So once you tie the patient into a collaborative relationship with his care provider or any kind of a coach, this makes the whole thing. It's actually, if you go back to the different ingredients like content, community, and tools, it makes those things much more meaningful because they are part of the dialogue between you and someone that is providing you care.
So this ties into one of our other favorite buzzwords, which is patient engagement. And I think you're touching on the question of why it is so hard. I think what you're saying is that we may have been going about this in the wrong way, because here we are, we're still talking about patient engagement as a great challenge, both from the provider and industry side and from the patient side as well. It sounds like you feel you've reached some sort of breakthrough in developing solutions that can actually yield patient engagement through a collaborative approach. Is that a fair statement? I mean, what do you think about patient engagement? Is that something we still need to be talking about?
Definitely. I think that it's something that is still not there, but we are getting there. Again, looking at the past and the new approach of collaborative digital systems, this first and foremost, I think that the notion that you give a patient an app and ask the patient to say, if you use the app, you'll be healthier, is a wonderful idea, and it's very logical. The only thing is that when you test it in the market, it doesn't work. Somehow our psychology doesn't support the idea of us coming in the morning and saying, how can I take care of myself so 6 months down the road I won't be hospitalized? Our mind is focused on the present. And so we had to change the way that we engage patients and move from the logical into the emotional. And what we learned, and this is hard-learned lessons. I can show you my scars.
Digital scars, I hope.
Digital scars all over my body. Yeah. Is that if you actually move from trying to teach patients that they should do it because they will be healthier into just, sorry for being so blunt here, but fool patients by creating relationships. I wouldn't say, I would use the term sugarcoat this very important thing into just create a relationship and we'll give you positive feedback. And this feedback would not be about are you becoming healthier 6 months down the road, but how you would feel today about yourself. You move the engagement from the logical into a relationship model. And once this is a relationship model, somehow our minds relate to that much better. So if I need to click an app before to register my steps, I will not do that, or taking a medication for that sake. But if somebody sent me a message and said, did you take the medication? I would answer him. The likelihood that I would do that is much stronger. So a collaboration, this collaborative environment are not just better patient engagement, they are totally working on a different side of the patient psychology.
Okay. So it sounds like your goal is to really meet people where they are, as opposed to trying to fit a so-called square peg into a round hole, or a human into an app, but created a human element as well. Can you give some more examples of the kinds of solutions that are built in your platform and the kinds of things that they're doing for people? You mentioned the idea of medication adherence. I know that your platform is pretty flexible and you're doing a lot of different things with some big names in healthcare. Would like to hear a little bit about what you're actually doing.
Okay, so first, we talked about digital therapeutics, and as we by now I mentioned, we believe that this is how all digital health or most of digital health will convert to, because it's a very powerful paradigm. Now, what Remedy is doing is basically recognizing that, and rather than creating those great services, and we love companies like Omada, or that is providing diabetes prevention plan through this model, or Livongo, which is taking care of diabetic patients and now extending to others. Rather than providing another service for another condition, what Remedy has done is we basically created a cloud environment that enables every stakeholder to go there and build very rapidly. We joke that it will be in a nice afternoon, but it takes few days, and you can have solutions that are as powerful as the Omadas and the Livongos, but with your own clinicians and with your own programs. So we made the transition from the legacy, the phone-based interactions, and the clinic visits into digital continuous interaction with patients, very trivial. And we like to look at the Remedy platform very much like WordPress for digital therapeutics. So if before you had to program to get to a website, now you just go to WordPress and configure it, and you have a wonderful website. The same goes here. If before you had to work for usually 18 months, 24 months with an investment of about $1 million to $2 million to get there, sometimes it was prohibitive even for companies to go there. Now you can just go there, get a tenant on the Remedy platform, and launch your service. Sometimes we have clients that do it in few hours. So that's I think the value proposition that Remedy provides. So is this clear?
Yeah. So let me understand. You mentioned earlier a live interaction with a coach. So that would be text-based, I imagine, through an application built on the platform. What are other sorts of services that are built on the platform?
So the paradigm, and I'll talk in a second about some of our installations, but the paradigm is very simple. If you go across all the digital therapeutics companies, you prescribe the patient some personalized plans, like you need to take your medication, you need to watch this video that will educate you about your condition, you need to answer some questionnaire. And then all that activities done by the patient are being channeled back to quote-unquote coach that can be their care provider. And we provide the care provider a dashboard in which they can look at the patient population and say, well, David is a great patient, but Amir is really not taking his medication and he's not reading the materials, the patient education that we provided him. And so we then provide on top of that a myriad of communication layers like text messages. We can also do a phone call or a video chat to connect with the patient. So it's a closed loop. You give a program, you monitor, and then you interact with the patient. So it's not just text.
Okay. And the content is developed entirely by your customers, or is it a mix of some suggested content for a particular disease state plus customized materials from the client?
We've been asked that a lot in sales calls, and the content, we prefer that the content will come from the client because there are wonderful, tried and true programs for taking care of patients, whether this is condition management or pre-post care or medication adherence, yada, yada, yada. And the only problem with those programs is that they are offline. So we provide them the platform to digitize them, so people get their pages and their scripts that they talk with patients, and just moving them to digital. We do also have now forged a relationship with a large patient education company. I cannot name the name because it's not still done. That will allow us to provide cookie cutters so that you don't need to start from scratch.
Got it. Okay. And your clients are healthcare providers, pharma companies, health-related companies. What are some sorts of programs that are running on your platform?
So it's an open-ended white label digital therapeutic solution. So for us, we didn't want to just limit ourselves to providers or payers, and we opened that to the market and wanted to see the pool from different segments. We have several segments that are actually very active. We have what we call the PRM, the patient relationship management companies, patient relationship, not companies, but patient relationship management needs. And this is predominantly with pharmaceutical companies. We have a project with Novartis and the American Heart Association as an example, or device companies. One of our bigger relationship is Medtronic, and there we support several projects as far as engaging patients and managing them, whether this is for condition management like diabetes, or it is just educating them about a new Medtronic device that they just got and making sure that they know how to operate the device. So this is the PRM side of it. We have also working with providers like Village Care. We have a wonderful project with managing 6,000 HIV patients here in New York with Village Care, and this is predominantly medication therapy management. And so this is an example of a provider that is using us for managing patients. We also have a strong foothold in wellness. We have companies like Better Health or New Start, and that are really taking the platform and using that for diet or for diabetes prevention plan. And something that has just evolved recently with several companies, both here in the States and in Israel, are behavioral health companies. I cannot name the names, but at this stage, but they use us for basically behavioral health and supporting patients on the emotional side. So if you look at it, we are really targeting several categories. What eventually we would like to see is that all stakeholders will use them. One thing that really excites us, for example, in the future is using the platform for beyond the pill for pharmaceutical companies, because we can support a product, a specific brand with a program and monitor patient activities and provide them guidance. It's wonderful for beyond the pill. And this is something that we would like to get into and other categories. So bottom line, all of the above.
Okay. If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and my guest today is Amir Kishon, CEO of RMDY Health, RMDY Health. Amir, you just threw out another term, another buzzword there, beyond the pill. I wonder if you could explain a little further what you mean by that phrase.
Okay. Well, this is a major thing for pharmaceutical companies because the traditional direct-to-consumer approach for getting patients and at least educated about their solutions, about their brands, is not working. From the various basic thing is that you don't go now to a TV shows, advertisement goes down, paper advertisement goes down, everything moves to digital. And just providing banners also do not work. So pharmaceutical companies basically have a big problem. And one thing that they are now looking at is taking digital and personalizing their support for patients through this digital channel. And adding that need with this whole plethora of wonderful capabilities that are provided by a digital therapeutics paradigm or platform, it makes all the sense in the world to use that and use exactly the solutions that Remedy or Livongo or Omada is providing to support patients who got, for example, a specific drug and want to educate them about first taking the drug on time, how the drugs benefit their condition, and continuously motivating them. I would like to kind of mention one thing that was for us was significant was that we work with Medtronic on a project that basically they used phone call centers to manage patients when they got a Medtronic diabetes continuous blood glucose solution. Now, we started working with them and moving that relationship that is done through the phone into digital. And with digital, you can prescribe plans for the patients, like patient education, videos. You can obviously create a channel of 24/7 chat and support for those patients. You can also obviously do telehealth. So we moved the legacy phone-based solution into digital, and this created about 500% better, more higher definition engagement with the patient, but on the other end, also create efficiencies because sending a text message is much more efficient than calling someone. So my mother always told me that you can't have the cake and eat it too. Here you have a solution that is both better from the engagement standpoint, but also more efficient.
Right. And some payers in healthcare are recognizing this now and are more inclined to reimburse for whether it's CGMs or other connected tools and services. We've been talking about platforms. I've been using the term platform, and we're talking about services in digital health and digital therapeutics. How would you define those or distinguish those? When you say platform, what do you mean? When you say a service, what do you mean?
If you look at the market today, you can basically divide it into two categories. You have companies that provide services, like we will take over your population and start managing that population. I mentioned Livongo, Mada, Propeller Health. There are other companies. It's just they have their own clinicians and their own programs, and they just take over such populations. This is wonderful for health plans because it's very easy. You just channel your patients to that service provider, and they take care of that. So that's the service providers. On the other end, there is a new paradigm of companies that would not provide a complete service, but provide a platform that enable other stakeholders to create their own digital services. And I would mention here companies like Twine Health that was recently acquired by Fitbit, by the way.
Right.
I was not surprised about that because if you want to get into healthcare, this is digital therapeutics is a wonderful platform to base your strategy on. And you have companies like Medacity and Wellframe and Remedy, and we all kind of operate in a framework in which we don't provide the services like the clinicians, most of us, but we actually provide just the digital platform that allows you to onboard your programs and your clinicians and move you from the legacy phone-based interaction into digital. So this is the distinction between those two categories. Now, David, you mentioned something about payers and health plans. I'm a board member of a health system in New York, and I see that also from within. And I see the health system is called MJHS.
Mm-hmm.
And I see us looking now at solutions to take care of high-risk patients and optimize our medical loss ratio and all those nice things. And it works great when you take some populations like diabetic population and move them to a Livongo, and some other populations that you take to another company. But when you think about scale and supporting the myriad of conditions that you have around, you will not sign up one category after the other, different companies, because you cannot manage that, both on the technical basis as well as the administrative basis. So we believe that eventually large health systems and large health payers will move to platform-based that will be customized across all their needs. So if they need to take care of, for example, high-risk pregnancy, they don't need to wait for another services company to pop up. They just build it in a week or two and launch it. And so my guess, and talking a little bit about the future, is that digital therapeutics will become sort of another enterprise system for health systems and health payers, very much like EMRs and claim systems.
Very interesting. It's sort of the next evolution that's coming ahead. Very interesting vision. So you are a man, Amir, who I think of as very calm, cool, and collected. We've known each other for a long time, but I know that some of the problems in healthcare must get you worked up. I hear the passion in your voice today. Is there what in healthcare gets you worked up? What makes you mad?
Yeah, actually, many things. First, something that I really find funny, and this is only probably the benefit of guys that has been there since 1995. It's actually scary how long. But since 1995, going to digital health conferences, I hear this theme of this year this will happen. Now digital will work, and I find it funny because it's talking and not doing. And you could see that also from this year conferences. Everybody talks about this is now AI and digital will do it. I think that we are in an opportune time. This is the first time that technology really supports us, and we have all the digital assets that we will require to a meaningful relationship with patients. Also, the patients are educated, and most importantly, also clinicians are educated because all of them are using an Android or an iPhone to communicate, so they are digital. And so there is here an opportune time to actually not just talk about this will happen, but actually make it happen. And so if you go across different stakeholders, one by one, there are question marks about why don't they embrace that and start running and moving forward. For example, we talked about health plans. Why are they so slow in adopting such solutions? It makes so much sense to take their inefficient and wasteful call centers and move it into digital communication. It's 5 times more efficient and 5 times more effective. Why not move there? If you look at health systems, and here I don't blame them because there is no model for reimbursement for such services, which drives me crazy in another angle. But why can't health systems embrace taking care of patients once they are discharged from, for example, an operation? I had actually an unfortunate situation. I had an appendicitis before Health 2.0, recent Health 2.0 in California, and so I was hospitalized for 3 days. Everything is fine, but when I was discharged, I got those kind of 70 pages that were printed very badly from the hospital, and this was my discharge instructions.
Terrific.
Yeah. To add arm to injury, about 10 days after that, I got phone calls from my Oxford as well as from the hospital saying how do I feel and if everything is fine. I could be dead by then, and so thinking that this status quo is working, while those patients have mobile phones and you can prescribe your discharge instructions to a mobile phone and start tracking those patients once they step out of the hospital, and you say, why aren't those systems embracing that now? This is kind of the thing that kind of on the health system side, I'm scratching my mind. I'm mad about the government that is now kind of, rather than continuously thinking about pushing everyone to collaborate digitally and incentivizing organizations to move forward, just allow health providers to just increase premiums and continue with the old game rather than fix themselves. And so I think that we have here a wonderful technology framework that can be embraced by all those stakeholders, and we need to kind of sit together and really think about how we stop talking and start doing. So that's kind of my 2 cents here.
Okay, that sounds like a good prescription for the future. Stop talking and start doing. Well, it's been a pleasure to be talking with you today, Amir. Thank you for joining us.
Oh, David, thank you.
You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.